Soybeans still grew in the field in front of Spartanburg General Hospital the day it opened on August 29, 1921. The shiny new building stood grand and tall against the Carolina sky, windows sparkling as people came to marvel at their new hospital. Spartanburg's leaders and the medical community had fought hard to open a general hospital, one to combine the patchwork of smaller medical facilities dotting the Spartanburg landscape at the turn of the 20th century. As the building opened, a number of those small hospitals transitioned their patients to Spartanburg General and closed their doors, eager to begin a new chapter in healthcare. The first patient, William G. Hyatt, was admitted by healthcare pioneer Dr. Hugh Black. Dr. Black had the honor of performing the first surgical procedure at Spartanburg General. The patient was his own son, Paul. From those first patients to the millions served since, that general hospital has grown more than anyone could have ever envisioned in 1921. Today, 100 years later, thousands of people following those first caregivers work tirelessly to welcome newborns, repair hearts, fight cancer, build strength, and to comfort and to heal. This is the story of that first 100 years, the story of the now countless men and women who dedicated their careers to providing excellence in healthcare, and the story of the nearly 10,000 who are today making healthy happen together. The original Spartanburg General Hospital had 4 floors, a basement, and a sub-basement for mechanical functions. There were dining rooms, a kitchen and laundry, x-ray equipment, operating and recovery rooms, a library, a pharmacy, and an emergency room. A solarium allowed patients to enjoy the medical value of sunshine and fresh air, and while there were a few private rooms, patients mostly bunked together in wards. There was also a maternity suite and a nursery. Spartanburg General Hospital was not the only facility to open that year. Wallace Thompson Hospital, now known as Union Medical Center, opened in 1921 as well. And in 1925, another hospital opened in Spartanburg, this one on East Main Street. Dr. Black opened the Mary Black Hospital, named for his wife and in partnership with his sons, Doctors Samuel Orr Black and Hugh Snoddy Black.
By the late 19th century, the medical profession had started to become more professional. Mostly physicians were treating people in their own homes, but occasionally they started to find that they needed some place to provide more intensive care to acutely ill patients or to patients who needed to have surgery. And so they would set up what were often called cottage hospitals because they were set up in homes. Some of those doctors are starting to build small buildings that were specifically intended to be hospitals. And so you do see that with the Spartanburg Hospital.
As long as Spartanburg General Hospital has existed, it has trained nurses. Nurses have been the lifeblood of the institution since day one.
You need to listen to your nurses. They can either make or break you as far as your patient care, and so we're so dependent on them.
The first class of nurses graduated from Spartanburg General Hospital in 1922. 18 graduates were honored with a dinner and dance at the Cleveland Hotel on June 15, 1922. Graduates earned as much as $35 a month. Student nurses earned $10 to $15 a month, but were required to buy their own uniforms and books. From the beginning, Spartanburg General adopted the Good Samaritan Hospital philosophy of patient care.
No applicant who may come to us in absolute need of hospital care and treatment shall be turned away because they have no means with which to meet their expenses.
The Great Depression tested that philosophy. Sadly, more than 700 hospitals closed between 1929 and 1938. However, Spartanburg General remained open, thanks in large part to one key group, its employees. Many accepted reduced wages and rallied around the hospital and their patients.
All employees remained loyal to the institution. In fact, it appeared that in the face of these reductions, their loyalty increased.
Patients often bartered for their care. Farmers paid in chickens, fruits, and vegetables. Their produce and livestock then fed the other patients. Flour and sugar sacks were turned into aprons and towels. One particular Depression-era innovation proved to be a harbinger of times to come. In 1934, Dr. Hillis Sheriff and hospital electrician W.C. Guy worked together to build a newborn incubator. It replaced the crude hot sand and bricks then used to warm newborns. That one incubator and the nurses in the newborn isolation room helped introduce the concept of a separate nursery for premature babies, a forerunner of our current Level 3 neonatal intensive care unit. In that same year of 1934, one more brick was laid in the future of Spartanburg's healthcare. As a project of Spartanburg General, the first local cancer clinic opened under the direction of Dr. John Fleming. It became one of the first programs in the nation to be approved by the American College of Surgeons Commission on Cancer. The United States rallied to fight World War II. To be sure, Spartanburg did its part. Area textile mills were recruited to make fabric for uniforms, parachutes, and tents. Farms and lumber yards also supported the war effort. From 1940 to 1946, more than 200,000 troops were trained at Camp Croft, a military camp opened by the Army in South Spartanburg County. It would serve the war effort as an infantry replacement center. At Spartanburg General Hospital, the call to service came from its superintendent, J.B. Norman. He wrote a letter to his employees entitled, "The Hospital Employee and National Defense." Written shortly after the attack on Pearl Harbor, Norman called on employees to do their part by working with passion and efficiency.
Many members of the medical and nursing staff are now or will soon be serving in the armed forces. This means that those of us who remain at home have got to work harder than ever before and assume a greater share of the responsibility.
Our School of Nursing began to work with the Army's Cadet Nurse Corps. The nurses could do most of their training at Spartanburg General and then transfer into the Army or the Navy or to a hospital for the wounded. This path allowed them to both complete their education and begin their war service. Local doctors also volunteered to serve during the war. And as the families of our servicemen then moved to Spartanburg to be near Camp Croft, they also relied on Spartanburg General for their care. As the war came to an end, Spartanburg General looked to the future. A higher standard of care became the new norm. And so, the hospital staff began to consider a new process called accreditation. A driving force behind this goal was Dr. G.B. Hodge. Dr. Hodge joined the staff in 1948 as Spartanburg County's first board-certified general surgeon.
I told them that I wasn't going to practice at a non-accredited hospital.
And so the hospital accreditation process began. Dr. Hodge wrote to the American Medical Association, and board-certified physicians began reviewing charts and improving medical documentation. Administrators wrote new policies, set new standards, and created oversight boards. Spartanburg General was accredited in 1948 and has received top grades since. Our facility continued to grow physically as well. A south wing was built in the 1940s, followed by a north wing with a new pediatric floor in the 1950s. Virtually every department of the hospital was expanded, from the emergency facilities to laboratories, laundry, and parking. Spartanburg General also opened its first off-site hospital campus in 1955. This 34-bed facility was located in Woodruff and eventually became known as B.J. Workman Memorial Hospital. The 1960s were an era of change for our entire country, and healthcare was no exception. The growth of employer-sponsored insurance plans made quality health care much more affordable. But the elderly, the poor, the disabled, they still had no access to health insurance. That is, until President Lyndon B. Johnson signed Medicare and Medicaid into law in 1965. The hospital was also touched by the social changes of the decade. Without incident, the hospital integrated on May 23, 1965. That portion of Spartanburg General, historically known as the Negro Hospital, then became the East Annex, a new area for the care of chronically ill and long-term care patients. 1 year later, in 1966, Charles C. Boone became the president of Spartanburg General. Mr. Boone's leadership heralded the beginning of an ongoing period, one of renovation, growth, and innovation.
From the day I arrived in this hospital until the day I retired, there was only 1 month that there wasn't a contractor's trailer on the property.
Programs grew and changed as well. New equipment improved diagnoses as healthcare leaders pushed for more outpatient care. The hospital worked with Spartanburg County leaders to establish an emergency medical services team to meet the growing national focus on improving emergency care. 1968 marked another historic moment for Spartanburg. Mary Black Memorial Hospital moved from its East Main Street location to a new and expansive building on Skyland Drive. During this period of overall growth in healthcare, both doctors and nurses began to specialize. At the same time, and across the entire country, hospital-based nursing training was being phased out in favor of college and university programs. Dr. Hodge and Mr. Boone rallied legislative and community support to form a local campus of the University of South Carolina, now known as USC Upstate. In May 1967, more than 150 nursing students entered the program, which was initially housed in the basement of the Spartanburg General School of Nursing. Diane Eastler, a native of St. Petersburg, Florida, was a member of the School of Nursing's last class, the class of 1969.
My admission was a little different because we had to be accepted by the University of South Carolina. And so we had to meet their standards.
During its 48 years, the Spartanburg General School of Nursing graduated 1,057 nurses. Although the University of South Carolina in Spartanburg had then taken the lead in educating nurses, Spartanburg General Hospital remained a place of learning. Spartanburg General's Family Medicine Residency Program became the first in South Carolina to be approved by the American Board of Family Practice, and only the 5th chartered family medicine program in the nation. The 1970s also brought the creation of an ambulance service, the start of our clinical pastoral education program, and groundbreaking for a $7.5 million surgical wing. Our Child Development Center opened in 1973. It immediately became a major recruiting tool.
I can remember my wife came down, interviewed, and got a job. And she called me back. We lived in Michigan at that time. She called back and said, "Sam, they have a child development center." I said, "What's the child development center?" She said, "It's a daycare on campus."
The 1970s also brought a series of local advancements in cancer care. The hospital's growing cancer division was certified by the American College of Surgeons Commission on Cancer. This certification was a reward for improved community outreach throughout the upstate as cancer doctors offered oncology seminars and lectures. These efforts also brought together a dynamic pair of oncologists whose teamwork would transform the fight against cancer in upstate South Carolina and beyond. Spartanburg native Dr. Julian Josie had been on staff for 6 years when Dr. James Bearden arrived in 1976.
After maybe a year, perhaps a little less, Jay came to me one day and he says, "You know, I'm a medical oncologist and I need to do medical oncology. I don't need to take cardiology call and I need to do my subspecialty." And I said, "Well, I don't really need to do general radiology. I just need to do this. And I can't do what you do and you can't do exactly what I do, but together we could be a team." And that really, it was about that simple. And it's been a marriage that has stood the test of time.
The two shared a passion for fighting cancer and a vision for creating a world-class cancer center. Eva Mae Smith is the mother of 10 children. Every one of them was on hand on that fateful day, March 17, 1981, the day she became the first patient to undergo open-heart surgery at Spartanburg General. Her family was understandably nervous, but Eva Mae said that her faith carried her through.
It didn't bother me. I just want to be quiet and stop that crying and hollering. Everything was going to be all right. The Lord was going to take care of it. I'm still living.
Cardiothoracic surgeon Dr. Henry Kelly performed the procedure. In a story celebrating the 25th anniversary of that first heart surgery, he told a reporter that Eva Mae was an ideal candidate.
So she's really blessed, like they say maybe 10 years that it will last, but look at it now, still blessed.
In 1986, the Charlotte Observer reported an unexpected fact. Spartanburg Regional had the Carolinas' lowest Medicare mortality rate for coronary artery bypass surgery. Mr. Boone attributed the Heart Center's success to the skill of the surgical team, then led by Dr. Joe Utley. A new $13.5 million Heart Center opened in July 1988 with 95 beds and the solid commitment to manage heart patients all the way from diagnosis to treatment to rehabilitation.
What were we going to do? We were the first in the Carolinas to do a full-fledged heart center, everything under one roof, with 95 private beds.
While heart services took off, Spartanburg General leaders joined a national conversation that began in the 1960s about new ways to address the end of life. In 1980, Drs. Bearden and Josie secured startup funding from the Appalachian Regional Commission, and Spartanburg General launched its hospice program. Mr. Boone became an important driving force.
There weren't many hospices in this country and in this state when we started that. I was just determined that we were going to have one.
Roberta Jennings was the first director. Her initial staff included a medical social worker, a chaplain, a volunteer coordinator, and a secretary. In 1984, Spartanburg General became the first Medicare-certified hospice provider in the Carolinas. Spartanburg General was also first to open an inpatient hospice unit, one which quickly became recognized nationally.
We had the only inpatient hospice in the state for a year.
Cardiac care and hospice care weren't the only two areas in which local health care shined. Spartanburg General opened new centers for psychiatry, radiation oncology, pain management, and for sleep disorders. It also took over management of Spartanburg County Emergency Medical Services. Within 5 years, it became a National EMS of the Year recipient. By the end of that decade, the Emergency Center earned recognition as a Level 1 trauma center. It became only the fourth hospital in South Carolina to receive that designation, and Spartanburg General became the largest employer in the county.
I started here in March of 1977. This place is nothing like it was back in 77.
And so, in 1986, to acknowledge 65 years of evolution, the Board of Trustees announced a new name for the ever-expanding hospital, Spartanburg Regional Medical Center.
You know, you just have to try to see a little bit in the future, and we did that. And so we were no longer just a hospital.
For Spartanburg Regional Medical Center, the future was just beginning. The successful launch of Spartanburg Regional Hospice put the spotlight on a difficult truth. Continuously expanding to meet the growing needs of a community requires a significant and a continuous investment.
We could not trot down to county council all the time and ask for money, bonds, to finance these projects because they were going to get tired of it.
Hospitals across the Carolinas began to form foundations to raise money, to support growth, and to educate the public about healthcare services. The fundraising efforts for hospice had proved to local leaders that the community very much wanted to help Spartanburg Regional to grow.
If we can get a really great board for the foundation and get people involved in the community, you know, if you put money into something, you support it. I mean, it's just that simple. And it took off like nothing I had ever dreamed of.
Leadership consulted with the Duke Endowment and then formed a blue ribbon committee of community leaders and physicians. After 2 years of research, the Spartanburg Regional Medical Center Foundation was organized in 1991. The first major fundraising campaign kicked off in 1993. Envisioned was an 8-story patient tower off East Wood Street. The Spartanburg community stepped up in a big way. The new foundation raised $3.3 million, of which $100,000 was donated by employees. Local textile leader Walter Montgomery and his wife Rose gave the foundation's first major gift. Named the Montgomery Tower, it opened in 1994. It would be the last major project that Charlie Boone would lead as president. After 30 years of service, Mr. Boone retired. He had served as the chief administrator for fully 40% of the time that Spartanburg Regional had existed. Accepting emeritus status, he kept an office at the hospital for years thereafter. The 90s were a decade of nonstop growth. The Regional Physicians Network, now known as Medical Group of the Carolinas, came into existence. The Heart Resource Center and the Physician's Office Building opened in 1990. The system's first mobile mammography unit began its service in 1993 thanks to a $150,000 grant from the new foundation. In 1994, the system also purchased Doctors Memorial Hospital on Serpentine Drive. It was then renamed the Spartanburg Hospital for Restorative Care and was dedicated to focus on patients requiring long-term acute care services. The Regional Outpatient Center opened in 1996 on the site of the 1921 Nurses' Residence building, which was demolished. The Women's Center also opened in 1996 with 33 private rooms designated for maternity, medical, or surgical care. Another name change was soon on the horizon. In 1996, all of these entities were collectively named Spartanburg Regional Healthcare System. Perhaps the biggest change of all came in 1999. Spartanburg Regional greeted the new century with the opening of the Marcia and Jimmy Gibbs Regional Cancer Center. For Dr. James Bearden and Dr. Julian Josie, this was a dream come true.
We're all in the same facility. We deal with an emergency together. We deal with treatment together. We talk about the patient.
The push for a major cancer center had been discussed for years, but it took a generous challenge gift from textile entrepreneur Jimmy Gibbs and his wife Marcia to open the doors before the turn of the century. Their challenge led to raising more than $3 million, $165,000 of which came from Spartanburg Regional employees.
Nothing like that had ever occurred in this institution. Almost a multi-million-dollar gift from a prominent industrialist in the community to do something for a not-for-profit hospital that took care of everybody.
The Gibbs Regional Cancer Center was one of the first to have all cancer services under one roof, this to support the modern vision of multidisciplinary care. To this day, patients are managed and supported from diagnosis through treatment and on into survivorship.
Gibbs Cancer Center, when I got here in 2011, obviously had a fantastic reputation. Heart and soul feels so deeply about Drs. Bearden and Josie and what they did so long ago to kind of rebuff the notion of for-profit medicine, particularly in oncology, and trying to honor that is a key driver for me personally.
Throughout their experience, cancer patients are surrounded by a special environment, one intentionally designed to invoke a sense of calm.
You don't come into a sterile place. You come into a place filled with lots of natural light, a beautiful garden that is just encompassed by the outdoor space, is encompassed by the indoor space.
It was a proud day in 2003 when Regional One lifted off for the first time. Described as a game changer, the Bell 407 helicopter allowed our Level 1 Trauma Center to save the lives of critically injured patients in a much larger area. Regional One became the first hospital-based air ambulance service in the upstate. In the decades since, Regional One has saved countless lives by rapidly connecting patients to critical care. On July 13, 2004, an incident involving a Regional One helicopter became the worst tragedy in Spartanburg Regional's history.
By far, that was the worst day of my professional career.
While returning to the medical center from a Newberry County accident scene, Regional One crashed due to poor visibility. Everyone on board was lost, including pilot Bob Giard, flight nurse Glenda Tesnier, paramedic David Bacon Jr., and their patient, Alicia Goodwin.
They were the hand-picked team that we had picked to start the program, and they had hearts bigger than life, and they were willing to put their lives on the line every day for our patients.
Tragedy may have dimmed the turn of the century, but it seemed that nothing could stop Spartanburg Regional's progress. After a period of exponential growth, the system still looked to the future, while it continued to solidify its role as the upstate's healthcare leader. In 2004, the Emergency Center expanded into a new 5-story pavilion adjacent to the Heart Center. This project tripled the size of the emergency department and created even more room for future growth. In 2018, the pavilion became home to multiple critical care units, and its potential was fully realized. A new chapter in hospice care opened in 2006 when Spartanburg Regional opened the $5.3 million Regional Hospice Home. It was then the only hospital-based hospice home in the upstate. Included in the milestones of the 2000s was the opening of the Beard and Josie Center for Breast Health, dedicated to making sure that all women had access to mammography, regardless of income. And in 2008, the system opened a brand new 48-bed hospital, the Village at Pelham, an acknowledgement of Spartanburg Regional's future.
Pelham was really foresightful by my predecessors.
It is known today as Pelham Medical Center. Pelham Medical Center became known for its quick and efficient emergency department, its top-rated stroke care, and much more. The adjacent Gibbs Cancer Center at Pelham became home to the revolutionary CyberKnife radiosurgery system. In March 2020, Gibbs at Pelham opened a 7-story expansion with easy access to the Greenville-Spartanburg International Airport. Gibbs at Pelham is poised to become a destination for cancer research and treatment. And the hospital system wasn't only growing west. In 2015, Spartanburg Regional acquired Wallace Thompson Hospital and Ellen Sager Nursing Home, both in adjacent Union County. They were renamed Union Medical Center and Ellen Sager Nursing Center.
We knew the patients. Those patients have been coming to us for years, and we'd really like to provide those services where they live and not have to have them travel back and forth. It's never fun to travel 30 miles back and forth when you're not feeling well.
4 years later, in 2019, Spartanburg Regional purchased the Mary Black Health System. This included Mary Black Hospital on Skyland Drive, the Gaffney Hospital, now known as Cherokee Medical Center, and all associated doctors' offices. For the first time, the 2 hospitals which Dr. Hugh Black helped to start in the 1920s were then owned by the same entity. The Mary Black Hospital had not been locally owned in more than a decade. Today, nearly 10,000 people from all walks of life, doctors, nurses, office workers, cooks and housekeepers, technicians and transport drivers, and more, are all united by a common purpose.
Extraordinary physician leadership over decades here. I've worked at lots of really wonderful health systems, but none more so than here.
And the leaders of Spartanburg Regional remain braced for our future. Administration moved to the Beaumont Mill building in 2016. With that move came the advent of Appella Health, the management company created to improve our competitive standing in the face of an ever-changing industry.
I think the future of Appella Health and Spartanburg Regional Health System are obviously intertwined, and they'll be intertwined for the next 100+ years.
Our Spartanburg Regional family is stronger than ever, but the year 2020 tested that strength as never before. COVID-19 changed nearly every aspect of daily life. During the pandemic, Spartanburg Regional took extraordinary steps to protect its patients, their families, associates, and our community. Donning personal protective equipment, frontline healthcare workers provided care to all patients, including those battling COVID-19. Working long hours under stressful conditions, they comforted their patients, who were also isolated from friends and family. Together, they healed. They grieved. When a shortage of personal protective equipment was feared, prominent businesses and several school districts donated thousands of surgical masks and face shields. Community members made masks by hand when wearing cloth masks became the new norm in public places like restaurants and doctors' offices. Drive-through testing sites opened in several upstate locations. Spartanburg Regional's management team was forced to face another new and challenging normal as employees learned to work from home. As the system approached its centennial, the fight against COVID-19 remained far from over, but our associates had proved that they were more than capable of managing such a tough task. Our story? Well, it began in a soybean field back in 1921. Through World War and social evolution, name changes, and technological advancements, our healthcare family met every challenge with dedication and with pride. As our story continues into the next 100 years, Spartanburg Regional Healthcare System remains committed to bringing world-class healthcare to the community in which it all began, and to the many communities that we now call home.